Blackheads are open comedones. Pores become congested with a mixture of sebum, skin oil, dead skin cells, and sometimes residue from skincare, sunscreen, makeup, or hair products. The dark color is usually oxidation of the material at the surface when it contacts air, not dirt. And preventing blackheads is fundamentally about keeping the follicle lining calm and shedding normally, keeping sebum flowing outward instead of thickening and stagnating inside the pore, removing daily buildup thoroughly without stripping the barrier, and avoiding chronic irritation or friction that triggers inflammation and rebound oiliness. The most reliable prevention system is simple enough to repeat every day and strong enough to change the biology of comedone formation over weeks. Gentle cleansing tailored to your skin type, consistent use of salicylic acid, BHA, to keep pores clear, consistent use of a nighttime retinoid to prevent microcomedones and normalize follicular turnover, daily moisturization to maintain barrier function so you can tolerate actives long-term, and daily sunscreen to reduce inflammation and support even tone and texture. Everything else is optional, and many people worsen blackheads by adding too many steps, scrubbing too hard, mixing too many actives, or squeezing frequently. The first priority is getting cleansing right, because a damaged barrier makes every active ingredient feel harsher and often makes blackheads worse. Harsh soaps, hot water, alcohol-heavy toners, and squeaky clean cleansers strip protective lipids, increase transepidermal water loss, and trigger microscopic inflammation. Irritated skin frequently responds with increased sebum production and more reactive keratinization, which makes pore contents thicker and more likely to clump into plugs. Use lukewarm water, cleanse with fingertips, not aggressive brushes, massage gently for about 20-30 seconds, rinse thoroughly and pat dry. Friction is not your friend in comedonal acne. Morning cleansing depends on your oil level and sensitivity. Oily or sweaty skin usually benefits from a gentle morning cleanse to remove overnight sebum and reduce the film that can trap dead cells during the day, while dry or very sensitive skin may do better with a water rinse or an ultra-mild cleanser so you don't begin the day with barrier stress. Night cleansing is the anchor for prevention because sunscreen, makeup, pollution particles, and product layers accumulate and mix with sebum. Repeated incomplete removal is one of the most common reasons blackheads persist even when you use good products. If you wear long wear sunscreen or makeup, consider a simple double cleanse at night. First, use a gentle oil cleanser or micellar product to dissolve sunscreen and makeup without scrubbing. Then follow with a gentle water-based cleanser to remove residue. This is often less irritating and more effective than trying to force everything off with one harsh cleanser. After cleansing, the prevention engine is consistent, pore-focused chemistry, and salicylic acid is the most directly useful over-the-counter active for blackheads because it is oil-soluble and can penetrate into the pore lining to loosen the bonds between dead cells, reduce the stickiness of follicular debris, and calm inflammation. It also helps with oily shine for many people. A leave-on salicylic acid product 0.5% to 2% is usually sufficient. What matters is correct dosing and consistency without irritation, not using the strongest product every day from the start. If you are new to BHA or you have sensitive skin, start 2 to 3 mornings per week. Apply a thin layer to blackhead-prone areas, commonly nose, chin, forehead, sometimes cheeks, hairline, jaw depending on your pattern. Then moisturize. After about 2 weeks, increase to every other morning if comfortable, and only move toward daily use if your skin remains calm, not stinging, not persistently tight, and not peeling in a raw way. If you experience dryness or stinging, step back by reducing frequency and increasing moisturization. Do not respond by adding stronger exfoliation or scrubbing, because irritation makes comedones more stubborn. The second cornerstone is a retinoid used at night because retinoids normalize keratinization within the follicle and reduce microcomedones, the earliest invisible blockages that later become blackheads. so they are the long-term recurrence prevention tool. They also improve overall texture and can refine the look of pores over time by reducing congestion and supporting healthier epidermal turnover. Where available? Adapalene 0. 1% is one of the best studied options for acne. Retinol or retinol can help too, but results vary by formulation and potency, and the method still matters more than the label. Use a pea-sized amount for the entire face, not spot treatment. Apply to completely dry skin at night. Damp skin increases irritation. Avoid the corners of the nose and mouth if you are prone to irritation, and follow with moisturizer. Introduce slowly. 2 nights per week for 2 weeks, then every other night for 2 weeks, then increase toward nightly only if your barrier stays calm. If you are sensitive, use the sandwich method moisturizer first, then retinoid, then moisturizer again, to buffer irritation while still gaining long-term benefit. Mild dryness and light flaking can occur early, but intense burning, swelling, cracking, or a persistent rash is irritation, not a required phase. The correct response is to pause actives for several days. Focus on gentle cleansing and barrier repair, then restart at a lower frequency. Many people fail with retinoids because they push too fast, become irritated, stop entirely, then restart aggressively, repeating the cycle. Steady, patient escalation is what prevents blackheads while keeping the skin comfortable enough to stay consistent. Moisturizer is essential even for oily skin because barrier stability determines tolerance, consistency, and long-term oil regulation. A calm barrier often produces less reactive oil and reduces inflammation that can worsen congestion. Choose non-comedogenic, fragrance-free, or very low fragrance moisturizers with barrier-supporting ingredients such as glycerin, hyaluronic acid, panthenol, ceramides, and possibly niacinamide if you tolerate it. For oily skin, lightweight gel cream or lotion textures typically feel best, while dry skin often needs a richer cream, but heaviness is not the same as effectiveness, and you can often find barrier-supportive formulas that feel light. The goal is not to eliminate sebum. Sebum is protective and normal, but to prevent sebum and dead cells from becoming trapped and oxidized inside pores. Daily sunscreen is another non-negotiable step because ultraviolet exposure increases inflammation, slows barrier repair, and worsens uneven tone and texture. If you use salicylic acid or a retinoid, sunscreen also reduces sensitivity and helps you stay consistent without getting progressively irritated. Choose a broad-spectrum SPF 30 or higher that you can wear daily. If a sunscreen seems to contribute to congestion, do not abandon sunscreen switch vehicles because texture matters. Lightweight fluids, gels, and non-comedogenic oil-free formulas often work better for acne-prone skin, and thorough removal at night matters more than the sunscreen category. A simple, high-success routine that prevents blackheads without unnecessary complexity looks like this. Morning, cleanse gently if needed. Apply salicylic acid on your scheduled days to blackhead-prone areas. Apply moisturizer, then apply sunscreen. Night, cleanse thoroughly. Double cleanse if you wore heavy sunscreen or makeup. Apply retinoid on your scheduled nights to dry skin, then moisturize. If you use both BHA and a retinoid, keep them separated by time of day at first, because stacking strong actives together increases irritation and reduces adherence. As your skin becomes stable, you can adjust frequency, but long-term success comes from a routine you can repeat with minimal drama. A practical ramp-up schedule that minimizes irritation while moving toward effective frequency is Weeks 1-2. Salicylic acid 2 to 3 mornings per week, and retinoid 2 nights per week. Weeks 3-4, increase salicylic acid to every other morning and retinoid to every other night if comfortable. Weeks 5-12, aim for salicylic acid most mornings and retinoid most nights, keeping 1 to 2 rest nights weekly if you notice dryness. Give the routine time. Early improvement often appears around 4-8 weeks, and more meaningful reduction in blackheads often appears by 12 weeks, because comedones form and resolve over cycles of follicular turnover. Switching products every week prevents you from seeing the true effect and usually increases irritation. It also helps to set correct expectations. Many dots on the nose are sebaceous filaments, which are normal structures that guide sebum to the surface. They can be minimized with the same routine, but they may not disappear completely because they are part of normal anatomy. So focus on smoother texture, fewer true plugs, and less visible congestion rather than expecting a poreless nose. Now address hidden triggers that repeatedly feed congestion even when the routine is correct. Hair products are a major cause of hairline and temple congestion. Heavy pomades, waxes, oily leave-in conditioners, and fragranced sprays can migrate onto facial skin, mix with sebum, and contribute to plugs. Keep styling products off the forehead and temples. Wash the hairline after styling if needed, and consider switching to lighter formulations if congestion clusters in those zones. Friction and occlusion are another common driver. Acne mechanica, tight masks, helmet straps, chin guards, frequent face touching, or resting the chin on a hand can inflame follicles and trap sweat and oil. Reduce friction where possible, keep masks clean and breathable, and apply a thin layer of moisturizer before mask wear to reduce rubbing, while avoiding thick, occlusive ointments under friction zones unless your skin is truly chapped, because occlusion can trap heat, sweat, and oil. Sweat management matters. Sweat itself is not dirty, but when mixed with oil and friction and left on the skin for long periods, it can contribute to congestion. Rinse or cleanse gently after exercise when practical, and change out of sweaty clothing. Small hygiene habits can produce real improvements because they reduce repeated redeposition of oils and residue onto the same zones. Clean your phone screen daily. Change pillowcases at least weekly, more often if you are oily. Wash makeup brushes and sponges regularly, and avoid pressing your face against unwashed surfaces. Makeup and sunscreen are compatible with blackhead prevention if removal is thorough. The most common issue is incomplete removal, not the mere use of makeup. If you wear long-wear products, prioritize thorough cleansing at night, often a gentle double cleanse, rather than compensating with more exfoliation. About pore strips, scrubs, and extraction. Pore strips can remove superficial plugs temporarily, but do not prevent recurrence and can irritate the pore opening. Abrasive scrubs create micro-irritation and inflammation that can worsen comedones. Frequent squeezing and digging at pores can damage the follicle wall, increase inflammation, lead to post-inflammatory hyperpigmentation, and in some cases scarring, and repeated trauma can make pores appear more prominent over time due to tissue remodeling. If you choose to extract occasionally, do it gently after a warm shower when the skin is softened. Use clean hands or sanitized tools. Apply minimal pressure and stop if it does not release easily. Pain and force are warning signs. From a prevention standpoint, consistent BHA and retinoid use usually reduces the need for extraction over time. If you want occasional add-ons that do not disrupt the barrier, keep them conservative. A clay mask once weekly can help very oily skin by absorbing surface oil and reducing shine, but it should not sting or leave you tight for hours. If it does, reduce frequency or skip it. A gentle AHA like lactic acid once weekly may help surface texture for some people, but it is less targeted for blackheads than BHA and should not be introduced at the same time as a new retinoid. Add one variable at a time and judge tolerance over 1 to 2 weeks. If salicylic acid irritates you, azelaic acid can be a gentler alternative that helps normalize keratinization and calm inflammation. It can be used in the morning or on non-retinoid nights, and often suits redness-prone skin. For body blackheads and clogged pores on the back and chest, salicylic acid body washes or leave-on treatments can help. Use them consistently. Leave them on the skin for 1 to 2 minutes before rinsing. Avoid harsh loofahs or aggressive scrubbing that inflames follicles, and change out of sweaty clothes quickly. Diet and lifestyle can influence acne in some individuals, though they are rarely the sole cause of blackheads. Higher glycemic load diets with frequent sugary drinks, candy, and highly processed snacks can worsen acne in susceptible people, and dairy, especially skim milk, can be a trigger for some. A practical approach is a time-limited experiment. Reduce high glycemic snacks and sugary drinks, and consider reducing dairy for 6 to 8 weeks while keeping skincare stable, then observe whether congestion improves. Avoid extreme restriction because consistency and overall health matter. Sleep and stress affect hormones and inflammation. Chronic stress and poor sleep can increase oil production and reduce barrier repair, so stable sleep routines and simple stress management can support clearer skin and better tolerance of actives, though they are supportive rather than standalone treatments. Climate matters. Humidity increases sweat and oil production and can make product buildup easier, so lighter textures and thorough cleansing help. Dry climates and air conditioning increase barrier dryness, so you may need richer moisturization and fewer active days to stay comfortable. Troubleshooting works best when your routine is simple. If blackheads are not improving after several weeks, check consistency first. Are you using salicylic acid at least a few mornings per week and a retinoid at least a few nights per week, with moisturizer and sunscreen daily? Then check irritation. Are you over-cleansing, using hot water, or stacking too many actives that inflame your barrier? Then check removal. Are you removing sunscreen and makeup fully at night, possibly with a double cleanse? Then check triggers: hair products, friction from masks or straps, face touching, phone screen and pillowcase hygiene, and sweat habits. If you notice what some people call purging, meaning small clogs surfacing after starting a retinoid or BHA, it should be mild and temporary and improve over weeks. If you experience burning, significant redness, swelling, or worsening irritation, that is inflammation, and the correct response is to reduce frequency and focus on barrier repair. Barrier repair is the safety net that keeps prevention working. If your skin stings when applying basic products, feels persistently tight after washing, becomes unusually red, or flakes in a raw way, pause actives for several days. Cleanse gently once daily, moisturize twice daily, maintain sunscreen, then restart actives at lower frequency once the skin feels normal. Safety considerations matter. If you are pregnant, trying to conceive, or breastfeeding, avoid topical retinoids unless a qualified clinician specifically advises otherwise. In that situation, focus on gentle cleansing, moisturizer, sunscreen, and conservative actives as appropriate. If you have eczema, rosacea, or chronic sensitivity, prioritize fragrance-free basics, introduce actives slowly, and consider azelaic acid as a gentler option. If reactions persist, professional guidance is appropriate. If after about 12 weeks of consistent, well-tolerated prevention, gentle cleansing, salicylic acid, a retinoid when appropriate, moisturizer, and sunscreen, you still have significant blackheads, or you develop painful inflammatory acne, scarring, or distressing discoloration, professional evaluation